Hi everyone and welcome to my presentation. Today I will be talking to you about my visit to the Manningham and Maternal and Child Health Centre. So the Manningham Maternal and Child Health Centre is located in Doncaster, so the eastern suburbs, and it is one of 6 maternal health centres. So there are 10 suburbs making up the city of Manningham, and there are 6 centres that are accessible for residents living in the city. It is a non-for-profit organisation primarily funded by the City Council and a little bit by the government. Their aims and objectives clearly stated even before you enter. There are a list, if you can see to the right of the screen, just here, of what their visits aim to achieve. So, in summary, the agency want to support and increase the bond between a mother and their child, and also offer services relating to the development of their child. So encompassing the physical, social, and mental aspects as well. The environment that I observed was very child-friendly. There's interactive games and learning outside in the waiting room. There are consultation rooms as well to have private discussions with professionals regarding any issues or anything that wants to be raised to do with the mother or the child. So that was really good. They offer a variety of services. So some include Mothers Group, which runs for 8 weeks. So once a week, the mothers are encouraged to meet and they can discuss any issues or concerns, or maybe just any positive experience as well, just about the development of their child. So it's more of a supportive network for mothers to create friendships, as they are then encouraged to meet after the 8-week program is done outside of the agency. So really helps to form friendships between mothers. They also offer consultations, kindergarten information, dietary requirements, informative seminars about development, and referrals to GPs and immunisations, which is extremely important. As we all know, childhood vaccinations, can prevent a lot of diseases, which are important for when they start kindergarten and primary school. So it's really important for parents to know about preventative measures against diseases and any form of illness, because it not only benefits their child but the rest of the community. So they're really invested in the public health of the community in that respect. They focus on providing support and education to new parents about their newborns up until the age of 4. So from birth, the parents are contacted. Obviously, because they live in the city of Manningham, they have access to their number and address. So they give them a call and offer their service. They can either accept or decline. One professional goes out and meets them at their home, or they can come to the actual centre. So they have that option there as well, which is really good for new parents to have that support. So there are no fees for this service, and the agency has a variety of information in the format of brochures, as you can see to the top right of the screen. They offer seminars, and their online website is also full of this information if you can't actually access to the centre. In terms of access to the centre in general, there's a large car park that I observed, as well as space behind the car park, so plenty of parking. It is located in Doncaster, and there's on Doncaster Road, so it's a main road with a lot of bus transport. So if you're not able to drive there, buses are also another option. They do focus on their service being equitable. So as you can see to the right of the screen, there are brochures in English, Mandarin, and Arabic. So they want to convey their information across different languages to really broaden their the diversity of their clients, which is really important, just to get the message of their services out there as well. And also just people having the option if they want to have their services or not. They can get a translator. They offer translator services on their own brochures, so that their customers, if they can't speak English, can have a translator come in with them and convey the information. So that is really, really fantastic, I believe. They also acknowledge the traditional custodians of this land. As you can see, the Indigenous flag is prompt on their desk to ensure that we are all reminded of the traditional custodians. So they really respect all cultures. They try to make it as equitable as possible in terms of the access and the cultural aspect of it as well. Limitations that I observed was no ramps. Now, the agency is located on the second floor of the Manningham Civic Centre, so it's already in a large building complex. So I didn't observe any ramps. I think there was one lift, which is good, but in terms of wheelchair access, it is quite limiting. The signs regarding the location of the agency are only present up until you actually get up on level 2, so where the agency is located. So there isn't any promotion regarding their agency, even just outside of the centre. So people might miss this information or be unaware that there's actually one of these agencies located near them. So increasing the promotion of their service would be quite beneficial. I do understand that the primary focus is on the mother and the child. However, in some circumstances, the father can be the primary carer, especially from a young age. So I feel that in future that they should adapt to having services and support networks that focus on the father as well, just to encompass that equality and make sure that everyone has that information as well. So not just the mothers, but the fathers as well. Okay. Thank you so much for listening to my presentation, and I hope you enjoyed it.